by the Montana Television Network. The 10 o'clock news continues on KPAX, Montana's news leader.
There are just 3 days remaining to enroll in a health care plan under the Affordable Care Act, and Montana leaders are urging people not to wait until the last minute. The health care enrollment period closes Friday. After that, you can only enroll or even change your plan if you qualify for a special enrollment period. Some 18,000 Montanans have signed up for the Affordable Care Act policies as of December 2nd. The Trump administration shortened the enrollment period from 90 days to 45 days. But State Auditor Matt Rosendale, who's Montana's Insurance and Securities Commissioner, says it sure doesn't look like this shorter window will affect the number of people who eventually sign up.
The insurers, again, have told me that everything is going smooth. The numbers are coming in where they anticipated them to be.
If you decide to opt out of health insurance, keep in mind you could face a tax penalty fee. For more information on how to sign up, we have that on our website. The debate over the future of Obamacare continues to simmer, and one of its biggest and most expensive elements is alive and well in Montana. That's Medicaid expansion. It is providing government-funded health coverage to tens of thousands of low-income Montanans and bringing hundreds of millions of federal dollars into the state.
Mike Dennison takes a closer look at who's benefiting from the program and its prospects for the future.
Ian Ballard left his job in Kansas City 2 years ago to come home to Kalispell to take care of some family business. He also had shooting pains through his legs and back, and at times could barely walk, let alone work, as he had been in the restaurant business. But then Ballard was able to get covered by Montana's expanded Medicaid and find out he had necrosis, which had severely degenerated both of his hip joints. Within months, he was able to get both hips replaced.
I didn't know that I had both hips gone and that I could lose the ability to walk. I would have had no idea had it not been for getting the coverage and then being able to get looked at and get worked on and everything that's come from it.
Ballard is one of 86,000 Montanans newly covered under Medicaid, authorized by the Montana legislature in 2015 and funded primarily by the federal government under the Affordable Care Act, or Obamacare. The expansion covers adults earning up to 138% of the federal poverty level, or about $16,600 a year for a single person, although 3/4 of the Montanans signed up so far earn less than half that amount. About $2 billion will be spent on health services covered by Medicaid expansion in Montana in its first 40 months, with most of the money coming from the federal government.
But it's been a great benefit to the entire state of Montana. Medicaid expansion has brought in $800 million of health care services in 18 months. That's almost $1 billion in treating the health of Montanans.
Nearly half that money is going to hospitals and clinics, but it's also paying for mental health and substance abuse treatment, dental care, prescription drugs, and doctor visits. President Trump and Republicans in Congress have sought to repeal the expansion and instead give a lesser pot of money to the states for Medicaid and let them decide what to do with it. Some GOP state lawmakers in Montana also worry whether the state can afford to keep up its share of the current Medicaid expansion.
There's no doubt about it. It has helped many individuals across the state, but it really comes down to the revenues we have available. So if we're going to fund this to the extent we need to, what other programs are we going to have to cut back in the state?
Yet for patients seeing the benefit, the expansion has been more than worth it.
I paid insurance for the better part of 2 decades and barely used any of it. I never expected anything back from it. So now I just find myself in a situation where it does pay me back. It's going to get me back up on my feet and able to get back into the workforce and then give back.
Reporting from Kalispell, Mike Dennison, MTN News.
Tomorrow we'll look how Medicaid expansion is boosting care for Native Americans and others across Montana. Still ahead, norovirus outbreaks on the rise in the Flathead and in Missoula, what you need to know.
We'll have that in Health Watch. Plus, our One Class at a Time grant winner will be helping to keep kids active. That's still ahead here on KPAX.